Hi, this is David from Direct Performance Physical Therapy,
And Rachel Buechler.
and we're here today to tell you about how direct performance can help you manage concussions in your athletes. So, first off, what is a concussion? A concussion is first and foremost a brain injury, and these injuries don't have to be a contact injury, they can also be non contact injuries, and the athlete doesn't have to lose consciousness in order to have a concussion. In fact, 90% of concussed athletes do not lose consciousness. Concussions are very common and they make up 6 to 7% of sports injuries overall, so how we manage them is extremely important.
Signs and symptoms of a concussion could be physical, cognitive, emotional, and sleep. So, issues with physical could be balance problems or headaches. Cognitive, you might feel slowed down or have issues with memory. Emotional, you just might not be able to control your emotions. And sleep, you might feel like you have to sleep a little bit more or have issues falling asleep.
As a coach, it's extremely important to have a triage plan for when an athlete sustains a concussion or a suspected concussion. A triage plan is basically the steps that you're going to take immediately after this situation occurs. So, step one, if you have an athlete that has a suspected concussion, is determining consciousness. If you go up to the athlete and the athlete is unconscious, we have to immediately assume that a cervical spine injury has occurred and their cervical spine needs to be stabilized. This can be done by a coach or a parent if they are trained. If untrained, leave the athlete untouched. If a athletic trainer or physical therapist is present, they can also stabilize the cervical spine. This athlete needs to be immediately transported to the emergency department.
Now, for the conscious athlete, we are looking for red flags. Red flags meaning that their injury is severe enough that we want to send them immediately to the emergency room. Now, some of these red flags might be severe or increased headache, double vision, convulsions, projectile or repeated vomiting, severe personality changes or weakness in either arms, legs, and any numbness or tingling in face and extremities. If you're unsure, you can always just refer them right to the emergency room. Athletes need to be removed from play even if symptoms resolve. When in doubt, sit them out.
Recognizing if the athlete is conscious or unconscious, as well as recognizing if there are any red flags, is the first part of the recognize, remove, and refer procedure for coaches. Along with understanding these signs and symptoms, we will provide coaches with information sheets for sideline reference. The second step, if you suspect a concussion, you need to remove the athlete from activity. If they have signs or symptoms of a concussion, A, they should be removed, and B, they should not be allowed to return to activity that day, even if their symptoms resolve.
It is important that coaches report any head injuries to the school or team athletic trainer.
After a suspected concussion, if there are no red flags present, the athlete can be referred directly to us for further evaluation, treatment, and management. The first thing that we're going to do with a suspected concussion athlete is administer the sports concussion assessment tool. This is the gold standard for assessing concussion, and it can help us determine the athlete's major deficits as well as the severity of their concussion. From there, we have return to sport and return to school protocols that we're going to follow to get the athlete better as quickly as possible.
Here at Direct Performance, we will work with the athlete and the teachers. Typically, the athlete will start with accommodations that decrease their cognitive activities. As their symptoms improve, these accommodations will decrease and the cognitive activities will increase until they are back to school full-time and doing regular schoolwork and tests.
Along with helping the athlete return to school, we also have a protocol in place for returning the athlete to their sport. This is going to start with minimal to no sport-related activity, and then gradually we're going to incorporate light aerobic exercise, sport-specific exercises, and then gradual return to non-contact and full contact practice. Following this protocol allows the athlete to safely progress from immediately post-concussion to a full return to sport. These next videos are demonstrating how we might treat somebody after a concussion to help them with their symptoms and ultimately help them return to their sport. The things that we're going to assess with them are going to be their vestibular system, their oculomotor system, their neuromuscular system, and their cervical spine, amongst others. We want to assess these things to figure out what the athlete's deficits are and what things we're most likely going to need to work on. Once we know their deficits, we really want to challenge the athlete within their tolerance for activity. We want to make sure that we challenge their balance and their strength and their neuromuscular function while we're also challenging their cognitive processing. This injury is a brain injury at the end of the day, and we want to make sure that we're challenging the athlete to think about things and process things while they're also performing exercises and challenging themselves with us. The final stage of this is going to be that return to sport process that we outlined earlier, as well as aerobic exercise. It's really important to get the athlete's heart rate up to a level that's going to mimic where it's going to be when they ultimately return to their sport.